Lisa. We're back. We're doing the female reproductive system. We're on part 11. We're going to talk a little bit about why we have menopause, theoretically, possibly evolutionary. So, evolution in menopause, there's some ideas. So, the older mother would not live long enough to rear an infant to a survivable age. Okay. So, the idea is there's a couple of things. Like, one, you would become infertile and then you would help rear your grandchildren. And that does become very important because, like, humans take like 25 years for your frontal lobe to be, uh, fully attached, right? And so, like, for chimpanzees to reach like adulthood, it's like 7 years. For humans, it's like longer, right? And even legally, we're looking at 18 years. So it's like quite a bit longer. And this partially has to do with the way that our brain hooks up, although it is a great problem solver. It just there's a lot of hookup there. Humans have teeny tiny little brain cells, and they take a long time to get all wired in right. Um, so it means that we have dependent kiddos, right? At the age of 7, a chimpanzee might be a parent. At the age of 7, you have a first grader, and they are not going to survive on their own. So they're very, very dependent, small children. So the idea is that we would have like a reproductive kind of age set, right? And then afterwards, we'd go into menopause and we'd use lower calories uh, and maybe take care of the kids. While those who are a little bit younger, maybe in their like more able-bodied years, are going out and hunting and gathering or doing whatnot. And then the kiddos are staying home with grandma and grandpa, right? And they're taking care of them and teaching them and doing all that good stuff. And not getting pregnant because of menopause, which ceases the ability to um, get pregnant any longer. So that's one of the main ones. Pleistocene skeletons or show early hominins rarely lived past the age of 40. Yeah, I don't know, but here it is. Um, So climacteric is different. So climacteric is a midlife change in hormone secretion. It is accompanied by menopause. So menopause is literally referring to the um, cessation of menstruation. So a female born with about 2 million eggs. When climacteric begins, there are usually only around 1,000 follicles left. Follicles are less responsive to gonadotrophins. They're going to secrete less estrogen and progesterone. Yeah, there it is. Um, Uterus, vagina, breasts all shrink, atrophy in size. Intercourse may become more comfortable. Vaginal infections are more common due to lack of or like thinning secretions. The skin around the body, the dermis, epidermis, and dermis become thinner too. Cholesterol levels, circulating cholesterol levels in the blood will increase and rise. Increasing the risk of cardiovascular disease. We don't know if that's because the metabolism for cholesterols change or what, but it looks like that's what's happening. Bone mass is going to decline. Osteoporosis is going to increase. Um, Blood vessels constrict and dilate in response to the shifting of the hormone balances. So that would be the hot flashes we're talking about. Um, Hormone replacement therapy, or HRT, provides low doses of estrogen and progesterone to kind of like give a little bit more of a, instead of falling off the cliff, and a little bit more of a step down into um, this like sans hormonal state. There are risks and there are benefits. They're being debated, and it's everything from mental health to physical comfort to cancer risks to stroke risks. So there's just a lot of dialogue going around. Always one-on-one with the care provider. Menopause cessation, like we just talked about, the menstrual cycles. It's considered menopause is considered to be finished when there are no more menstruations for a whole year. This usually occurs between the ages of 45 and 55, and the age of menopause has increased in the last century, so it's like becoming a little bit later on. Okay, next we'll talk about oogenesis and the sexual cycle. I hope this was helpful. And I hope, right, so climacteric is like the overall changes, menopause is cessation of menstruation. right? So define those differences. So I hope that was helpful. I hope you're out there somewhere having a great day. Bigger smile. There it is. Okay, bye.